Hello everyone, welcome to this session where we will start studying together different economic evaluation models in health technology assessment. Studying the economic evaluation models is very important for anyone involved in healthcare, especially those involved in healthcare decision making and anyone working in the pharmaceutical industry. Simply because, as we discussed earlier, all the healthcare systems all over the world are facing constant pressure to deliver better outcomes while still they have to manage limited budgets. In order to study these models, we need to know about 4 models that are globally used in health technology assessment to guide evidence-based decisions. And these are 1. Budget impact analysis to forecast the financial impact of adopting a new intervention or a new technology or innovation. And this is our topic today. 2. Cost-benefit analysis to weigh costs and benefits in monetary terms. 3. Cost-utility analysis to measure value using quality-adjusted life years, which we discussed last episode. And finally, the cost minimization analysis to find the most efficient option when outcomes are equal. Today, we will start with the budget impact model, and to do so, let me share a story with you. Let's imagine a pharmaceutical company presenting robust data to a national health authorities for a new oncology treatment or a life-saving vaccine. And they have already provided data to show that their medication is cost-effective. Clinical trials results were positive and strong, and the cost per quality-adjusted life years is within the willingness to pay threshold of the healthcare system. When the therapeutic committee reviewed the data and the cost-effectiveness analysis, actually they accepted the evidence that the treatment offers good value for money. However, they still said that despite they agree that it is a cost-effective medication and intervention, but they still cannot afford it, at least not this year. This scenario is happening a lot, almost every day. So it is not actually a matter of scientific issue, it is not a clinical problem, it's a budget problem. Then, why this is happening if the cost per quality adjusted life year is within the willingness pay threshold of the healthcare system? Why they cannot afford it, or why they think they cannot afford it? This is happening because cost effectiveness alone is not enough, and you cannot actually rely on it to make the right decisions. To explain myself more, let's think of a treatment that can offer great value for money according to the cost effectiveness analysis. But still, it can be unaffordable in the current budget. And the opposite is true, by the way. So if regulators say that they cannot afford it based only on cost analysis or cost effectiveness analysis, they may be just making an assumption. But if they evaluate the situation and the new medication using what we are discussing today, budget impact analysis, only then their decision can be fully justified. In order to understand the importance of budget impact analysis, we need to understand how it is compared to cost effectiveness analysis. Because while both are used whenever introducing a new medicine or a new technology or a new healthcare intervention in general, but actually they are completely different. Cost effectiveness analysis answers a question: is this treatment worth the money that we spend on it? It compares costs with health outcomes, like life years gained, complications avoided, or quality-adjusted life years. For example, drug A costs $10,000 and offers 0.5 extra quality-adjusted life year compared to drug B. The cost-effectiveness ratio in this case for drug A will be 20,000 per quality-adjusted life year. So cost-effectiveness analysis is used to judge the value for money. It helps, of course, the governments, the health technology assessment bodies, payers, to to decide whether a treatment should be reimbursed based only on clinical benefit versus cost or not. On the other hand, budget impact analysis answers a different question, a completely different one. Can we afford it? What it will cost to the healthcare system in the next few years? So here in this case, it adds the affordability to the cost effectiveness. So budget impact analysis doesn't only focus on value, but it focuses on affordability and also cash flow. It calculates the financial impact over a short-term period, usually 1 to 5 years. In order to do this, the budget impact analysis requires certain factors to consider, including, for example, the number of eligible patients or patients expected to switch to the new intervention, market share of the new drug, price, discounts, and uptake speed. And also it helps to answer the question, what will be added or saved in the actual budget in this country? Budget impact analysis helps payers and hospitals to understand how this new drug affects their own budget today and in the near future, not whether it provides good value per quality adjusted life year. So do we need only budget impact analysis and let's forget about cost effectiveness? No, in fact, we need both. Why we need both? Because a treatment can be cost-effective but not affordable. Example, a cancer drug offers good value for money but will cost the healthcare system more than 100 million next year. The budget cannot be absorbed. Or the opposite. A drug can be, or a treatment can be affordable but not cost-effective. Example, a drug with average or poor clinical outcomes, it fits the budget, but it doesn't add value. So decision makers need both parameters or both analysis. The cost-effective analysis to measure the value per cost and also the budget impact analysis to measure the affordability. That is to say, if the decision maker or the pharmaceutical industry are using only one of these two models, the decision may not be correct. Before we go ahead, let me share two examples to show you how budget impact analysis works in real life. And let's say that we have a new diabetes medication in a country where the healthcare system currently treats 10,000 patients with standard care, less expensive diabetes drugs. The new medication, when it enters the market, it is more expensive per dose, but it reduces hospital admissions due to better blood sugar control. Budget impact analysis in this case will calculate how many patients are expected to switch, what the increase in drug spending will be, and how much could be saved from the fewer hospitalizations. The results of this analysis might show a modest net budget increase in the first year, but cost savings after year 2, making it easier for payers to justify the adoption. Another example about a new vaccination program. Suppose a new vaccine is introduced to prevent a serious seasonal illness. Budget impact analysis would estimate the cost of the vaccination, the target population, including the distribution, administration, cold supply management, and it will compare this to the savings from avoiding doctor visits, treatments, hospitalization, and work absences. The analysis could reveal that while the upfront investment is significant, the health system will actually save millions by avoiding treatment costs during the same year. So these examples show why budget impact analysis is so important. It gives the decision makers a clear picture of short and medium-term affordability, helping them to plan budgets, negotiate with manufacturers, and avoid surprises once a technology is adopted. And once again, budget impact analysis is not about proving value compared to the cost. to the expected outcomes, like the cost effectiveness analysis, but it is about ensuring that an innovation can be integrated into a specific healthcare system without destabilizing resources, which is the language most healthcare systems are speaking today. But there is a tricky question. What if healthcare system in a country relies only on cost effectiveness analysis and not asking for or using budget impact analysis? This is a different problem because the decisions would be based on assumption rather than being evidence-based decisions. Here, the manufacturer or the pharmaceutical industry must both be collaborative and proactive in providing budget impact data and also get themselves engaged in an educational journey with the regulators and decision makers in order to ensure new innovative medications are reaching the patients by avoiding decision based on assumptions or even previous experience. It is important to note that some healthcare systems may be under impression that they cannot afford a medication or a new technology. However, when the manufacturer addresses a 5-year budget impact analysis, they can definitely see that they can afford this intervention. On the other hand, budget impact analysis, understanding it and its requirement is very important for the pharmaceutical industry, and we can highlight 5 important reasons. 1, the success in market access depends on affordability, not only on clinical evidence. So a drug may be clinically superior and cost effective, but if it places too much pressure on a national or a hospital budget, payers may delay, restrict, or reject access. Budget impact analysis answers the payer's most practical question. Can we afford this drug next year? Without a favorable budget impact analysis, reimbursement may not happen, even if the science is strong. The second reason, understanding budget impact analysis helps pharma or the industry or the pharma teams to design realistic pricing and launch strategies that helps to set sustainable pricing models, helps to create reimbursement dossier, helps to choose the patient population sizes for the launch plan, and it ensures that pricing is not only justified clinically, but also financially manageable for healthcare systems. So, speaking the same language of the healthcare regulators and payers. The third reason is that the budget impact analysis supports negotiations with payers, health authorities, because they don't only want to know if the drug works. They wanted to know how it affects their annual budget, workplace, and other resources. Professionals who understand the business impact analysis can speak the payer's language, negotiate better risk-sharing agreements, budget caps, outcome-based pricing. Okay, the fourth reason is that budget impact analysis is very important for the industry because it prevents launch delays and market restrictions. Many drugs, are delayed or launched with heavy restrictions because of the financial burden, and the financial impact was actually underestimated. So understanding budget impact analysis allows you to adapt launch tactics early, prepare for objections from payers, avoid surprises that block or delay the market entry. Finally, and the reason number 5, it shows real-world impact, not just the value per quality adjusted real life. So budget impact analysis, as we mentioned, it adds affordability to the evidence. It counts real numbers. How many patients will use the drug in the first year? How much will hospitals pay out of the pocket? Will budgets need to increase, or will savings offset the cost? This information that decision makers need urgently, and pharma professionals must be ready to provide it on time. And finally, when we say budget impact analysis, it's important for the pharmaceutical industry. I mean for everyone in the pharmaceutical industry, from medical representatives to CEOs. We are all now involved somehow when it comes to patient access to innovative medications. To wrap up, cost effectiveness analysis tells us if the drug is worth the money. Budget impact analysis, on the other hand, tells us if we can actually afford buying it without destabilizing the budget for the coming few years. So, if healthcare systems want to bring the best outcomes and the best innovative solutions to their patients, and if the industry wants to deliver breakthrough innovations, we all need to update our knowledge and add budget impact analysis to the conversation. I'm not saying that it ends here. There are other economic models that address other questions, which we will highlight in our near future or our next episodes. Thank you for joining me today in this important discussion, and see you next time.